Yes.
Good morning.
According to the website, it says that.
And welcome to the Sarah Stevenson Tuesday Morning Forum. My name is Laura McClady, one of the facilitators for the forum, along with Mary Johnson, Winston Robinson, Jackie Edwards, Walton, and Natalie McGarrett, Steve Johnson, and Thomas Moore. We'd like to welcome our guests, and we'd always like to start off with the word of prayer. And Jazz is going to lead us in a word of prayer. One of our young folk.
Amen.
Good morning.
Good morning.
Bow your heads in prayer. Heavenly Father, thank you for this day. Thank you for waking us up on this great Tuesday morning. Thank you for allowing the panelists to come in safe. Thank you for anybody who is on the way, and thank you for those who are here. We pray that this information is well received, and we pray for great networking and fellowship afterwards. In your name we pray. Amen.
Amen.
Thank you so much. We're laying it out here for our young folk, just to let you know. We'd like to welcome our guests this morning, our speakers, and for those that are here for the first time, and I think it's most of our speakers that are here for the first time, we facilitate this forum by asking you to do a presentation, and we give you 3 minutes to present and introduce yourself and present 3 to 4 minutes apiece. And once you present, we facilitate the question and answers process. We have a timekeeper, Natalie, who is in the back. And please respect her. Respect her when she holds up the sign. And we ask people will be coming in respectfully and they will leave respectfully. So we never know who will show up at the Tuesday Forum. So just be patient with us on that. We have with us this morning Ms. Trina Palmer with Mecklenburg County Senior Health Insurance Information Program, Suzette Chrisman with Lilly Insurance, Medicare, and John Wall, who is an insurance broker. And they will be sharing information with us this morning that is critical to us seniors anyway. We know that. But it's something that I think that all of us can work with or share information with to our friends. So without any further ado, I failed to mention Steve. Steve Johnston is the person that puts all of this together, from our coffee to our live streaming, and to make you aware of the fact that you are on live streaming. This will be recorded. You can always go back and look at this presentation this morning through our website, the Sarah Stevenson's Tuesday Forum website. Feel free to do that and invite others to look at it as well. But we'd like to make sure that you will not only be with us today, but come and visit with us later after today, and invite others to come and visit with us at Tuesday Forum. We usually meet almost every Tuesday throughout the year. We only miss a few. And this crew that's here, along with a few others, is normally here. But as I said earlier, we never know who's going to show up once the invitations are sent out. So without any further ado, when you use your mic, please talk into your mic, because he's recording all of this, and we want our viewing audience to be able to hear you as well. So without any further ado, we have Trina. Yes.
Excuse me for interrupting you, but you said they only have 3 minutes to do your presentations?
Yes.
You give them longer than that to do their presentations.
Okay. So how long?
I don't know how long their presentations are.
Okay, Mary. How long?
How long are your presentations?
Mine's mostly questions. I'll say just the basic, and then I just ask for questions.
3 minutes is good with me.
Okay.
I can talk from 3 to 30. So you tell me how much time I have, and that's how much time I'll use.
I do 3.
Okay, we'll say no more than 5 apiece. How about that?
To start with.
Okay, and then lots of questions.
Okay. and just watch Natalie, she will let you know. Thank you. Okay, so without any further ado, if you guys will just go ahead and introduce yourselves.
Hi.
Hi.
Trina Palmer here. I've been a social worker for, do I dare admit, 42 years now. And now one of my jobs is I'm a SHIP counselor. Stands for Senior Health Insurance Information Programs on the front page of my handout. The reason SHIP exists is so that seniors can get unbiased information about Medicare. Anyone who talks about SHIP or does SHIP counseling one-on-one is not allowed to have anyone in their family sell insurance at all. We have to verify that every year that no one's selling insurance in my family, including Medicare, not just Medicare. They really make sure that someone who hears from us knows that we're not representing any one insurance company. The reason I'm out today, and I do a lot of these right now, is because it's open enrollment. So if you go to the second page, to open enrollment, October 15th through December 7th. Main things done during this time are to compare drug plans, what are called standalone drug plans, D plans as we call them in the Medicare world, or to compare Advantage plans, because this is one of the times that you can switch your Advantage plan. And it is important to shop your drug plans, the next page. You must shop your drug plans every year. Why? How many in here are here representing someone who's on an Advantage plan versus someone who's on what we call regular Medicare with a drug plan? Advantage plan mostly? Advantage, okay. Okay. Anyone here looking to know more about standalone drug plans? You might run into someone, so I'm going to run over that real quickly. Standalone drug plan, when you turn 65, or if you're on disability for 2 years, then you get on Medicare regardless of what age you are. So once you get on Medicare, you normally get Part A, hospitalization. Part B, all the outpatient therapies and things like that fall under Part B. A and B normally only pay 80% of the charges. So if you're going to a doctor's appointment, that's Part B. Your Part B would kick in and only pay 80% of the cost of the approved cost of the appointment. So something else has to pay the 20%, right? So you can buy what's called a supplemental plan or a gap plan, cover that 20% gap. Or you could join an Advantage plan, right? Where you put your red, white, blue card away and you carry your Advantage plan around with you because it includes Part A, Part B, for most people, or A and B, and prescription drug plan, and covers some of the gap that occurs if you don't have anything. And then there's the people who have A, B, a gap plan. They still need to purchase a drug plan, what we call a standalone drug plan, to get any drug coverage. So people on drug plans need to shop for their drug plan during this time, because it's the only time of year you can shop, October 15th through December 7th, because your drug plan premium can go up, and you should already been notified by your drug plan if you have a standalone drug plan. They should have already notified you if your premium is going up. But what they're not so good about telling you sometimes is the plans may change which drugs they cover this year versus this coming year, 2024, versus what was covered in 2023. And the really sneaky thing that can happen, they can change which tier your drugs are on. Lord, I started being a SHIP counselor in 2005, I think it was. And there were basically 3 tiers for drugs on drug plans. Now there's like 5 or 6, depending on which drug plan you're in. They have preferred generic, tier 1, tier 2, tier 3, tier 4, tier 5, and some now have a tier 5 plus, which means they're very, very expensive drugs. So from one year to the other, if you stay on the same plan, what drugs they cover and how much they're going to cover for those drugs can change. So everybody who has a drug plan needs to look at that. Now, Advantage plans, same thing in some ways. Advantage plans can change what doctors are in them, right? The plans can change premium or close down. Some Advantage plans just go away every year. Plans can change to approved providers, hospitals, urgent cares, doctors. Plans offering drug coverage may change which drugs are covered and what tier those drugs are on. Plans may change co-pays, therapies, coverage, and add-on benefits. All that can change in an Advantage plan from year to year. So that's why it is so ultimately important to look at your Advantage plan if that's what you're on. So what I also provided for you in your handout was a list of all the drug plans for 2024, the standalone drug plans. So if you have any family members that are on a standalone drug plan, make sure they talk to somebody, preferably a SHIP counselor, because we don't, support any one insurance company. And you'll notice on this, there's a red line through Clear Spring Health Value RX. You know why? They screwed up last year. They promised stuff they didn't do. And so they got kicked out by the state. They're not allowed to offer this year. So everybody who's on a Clear Spring Health Value RX was on that plan. Any Clear Spring Value plan was closed down. Should have gotten a notice from their drug plan saying that. The other thing I have here is why it's so important to shop for your your Advantage plans, because these are all the approved Advantage plans in Mecklenburg County. Every year there's more, and every year some go away. And you'll notice out to the far right, you got your premium, your annual drug deductible, your drug benefit plan, additional coverage during the gap, contract number ID, and a big thing is in-network maximum out-of-pocket amount. And see how much some of that is different. So my time is up. I'll be glad to answer questions, but I wanted you to have the basic information in front of you, and then I'll answer any questions after these other two lovely people get to talk as well.
Am I next?
Okay.
As well.
Thank you. The mic is on.
Awesome.
And I scoot around here. Okay. Hi, everybody. Welcome and good morning. You know my favorite color. My name is Suzette Chrisman. I'm with Lily Insurance. And just so you know, Lily is actually the meaning of my name. That's how that came about. My name means Lily in French and in Latin. So I wanted to come today just to introduce myself to you. And that way you'll know who I am. And I'll tell you why. First, I'm going to start off with why I started in the Medicare business. It's personal for me. So my parents didn't know about SHIP when they turned 65. So I am one of 7. So in my family, I was the one that helped out with the paperwork with the family. So my parents turned 65. My father is on 1 blood pressure pill, not an expensive one. My mother had no medications at all. So we thought they were covered. But what happens with time? With time, things happen, right? And so now they needed medication, so we thought this is gonna be easy. We will just get them a prescription drug plan. Now, I have a little something for you if you answer this right. What happens if you do not, and you have to raise your hand, I'll grab my purse really quickly. What happens if you do not sign up for Medicare prescription drug plan when you are eligible?
When you're first eligible.
What's that? There is a penalty. Got a little gift for you. So yes, there is a penalty if you do not sign up. My parents went 12 years without signing up for a prescription drug plan. My mom unfortunately passed away about 3 years ago. She paid a penalty until she passed away. My father pays a penalty every month. So I was furious as a child because I thought somebody should have told them. Well, like I said, you've been around since my parents were in the industry since my parents were 65, so SHIP was around. I had never heard of them. How many of you get that Medicare in your book? Every year. You read it all the way through, right? No. Okay, well,
counselors do.
Right.
We highlight stuff.
I promise you, in that book, there is a part that tells you about the Part D penalty.
Yes.
So, you know that saying about ignorance is bliss? It's not. It's going to cost you, and it cost my family. So I was already an insurance agent doing something else. But when I realized what was happening to my parents, I had to get more educated. And I thought, I'm not selling Medicare. No, insurance. That's too complicated. And it was. But I realized that complication cost my family. And more and more I talk to people, I realize it costs a lot of people because they don't know. She gave you a list of plans. If you do the math, there's 50 plus plans just in Mecklenburg County. You can absolutely do the research on your own. You have SHIP who can help you do the research, which would probably be better. I myself am an independent broker, which means I represent a number of companies. I have no loyalty to any insurance company. I have a loyalty to whoever I'm talking to because I realize that the decisions you make can cost you money. And honestly speaking, we all have to live, right? And there's things that we have to do. So I want to just ask another question because I like giving out things. We mostly think of Medicare as a senior citizen's insurance, right? Okay. What's the other way that you can get Medicare if you're not over 65? Anybody know?
Disability.
All right. I'm gonna grab your gift as soon as I'm done. I got something for you. Okay, yes, disability. So just learning things like that can be very beneficial. And I wanted to, like I said, I wanted to introduce myself to you this year. I've been talking to Laura's son has been my parents' insurance agent for a long time, and I know how important it is to have a relationship with those that you talk to. The information that's provided on CMS.gov, on Medicare.gov, the information I look at too. I just make it my business to do all the research for all the plans, and that way, beyond just the education, after the fact. You know, sometimes around this time of year, and I know y'all get bombarded, right? Phone calls, stuff in the mail. And if anybody shows up at your door without an invitation, that is illegal. Okay? I was offered a job once that said, I'll give you an iPad, you can go wherever you want to go in this area, because I'll give you a list of everyone that's turning 65. And I said, wait a minute, that is illegal. I don't want to lose my license, but beyond that, I'm an ethical person. So I feel like it's very important to do things the right way. So that is illegal. Now, I'm excited that she's here in person because generally we don't have a relationship. We can't call it a ship because we're insurance brokers. But there are unique situations that I tell people, you need to find out what's going on with this so that you can get the information that you need. So I try to be a resource for everyone. I'm going to pass out our little card later on. We're a family-owned business. It's myself and my husband. During this time of year, I also employ one other person. I am bilingual. I learned Spanish some years ago, and I found that in the foreign community, a lot of times the lack of education is incredible, and it's very costly. I have so many experiences I could tell you about that. So around this time of year, I used to live in Nicaragua. My old roommate married a Nicaraguan and still lives there. So around this time, sometimes if you call that number, you'll get us. But what I wanted to tell you today is, this time of year is important because you need to know your options. But let me ask you something. Last question. Is there any other time of the year you can make a change? Mm-hmm. You can't answer.
I know.
Anybody know any other time of year besides this annual enrollment? October 15th to December 7th.
Yes.
Wait, you both answered. Anybody else who hasn't answered yet? Was that what you? Yeah. Okay, what's the other time of year? Okay, that counts. They're actually different. Exactly. They're called special enrollment periods. What are those special enrollment periods? It varies. Sometimes it's a disaster. I'm from Detroit, Michigan, and a few months ago, there was a special enrollment period in Michigan for violence. I don't know what was happening there. But it was an enrollment period for that. Sometimes it's a disaster. Sometimes it's your circumstances. You've moved out of the county. As she was mentioning, sometimes the plans can pull out of an area, and it may not always happen at this time of year. So there's a number of reasons why you can make an adjustment. Why would you want to? But think about it. What are your needs? Because what your needs are right now, our health could change in 4 months, 5 months. And now we're on a medication that she mentioned about the different tiers. Every company has a drug list. It's called a formulary. So maybe today my medication is covered. Something happens a few months down the line and now my medication is no longer covered on my insurance. What do I do? Panic. You could panic. You could. Well, the first folks who will work with me, they know. Keep in touch with me. I'll help you through this. Because there are a few things that you can do. You can ask for an exception formulary. All right, my time is up, but I'm going to be here to answer questions. I know my dear friend over here has a lot more information to share with you. Once again, my name is Suzette Crispin, and I'm going to walk around and just hand you my little card so that you have my information. Thank you so much for your time.
Good morning, everyone. I'm going to take a few minutes to introduce myself to you. I think it's important for you to know who you are, who's standing before you. My name is John Frank Wall, W-A-L-L. I'm not some people confuse me with the principal at Charlotte Mecklenburg Schools. I am not him. I'm a business owner. I'm an insurance broker. I live in the Hidden Valley community in Charlotte. I've been there for 52 years. I hold a bachelor's degree from the University of Alabama in Tuscaloosa, a 1985 graduate. I am married. I have 2 adult children and 3 grandkids. So I'm delighted to stand before you this morning. I wanted to acknowledge the heirs to the Tuesday morning breakfast forum, the ladies who will perpetuate this forum and take it into the future. And having said that, I have a check for donation to the Tuesday morning forum. Right now the check is blank, but we're going to fill it in with blanks for you. But I'm delighted to be here. I usually watch the Tuesday morning forum from home, virtually. But I was invited, thanks to Jackie Walton, to be here this morning to share with you some insurance information. There are 3 things I want to talk about. The first one was me. You know who I am. I'm licensed in North Carolina and South Carolina. You have to hold a license to sell Medicare and Obamacare insurance. That's what I do. I'm insured, and I'm licensed in North and South Carolina. And you have to have insurance to be an insurance agent. The second thing I want to tell you is that I've been appointed to do the Obamacare, the Affordable Care Act, aka Obamacare. So I work with families, and I believe in the totality of the family. Everybody in the family needs to have insurance coverage, either Obamacare or Medicare, or either Medicare or Obamacare. Everybody in the family needs to be covered. The last thing I want to say to you is that, on Obamacare, I specialize with helping people get subsidies to pay, if not 100% of their insurance premiums, a large percentage of their insurance monthly premiums. That's what I do. And I feel very fulfilled doing that. And then lastly is that what I do with Medicare is I work with seniors and folks who qualify for Medicare who may have a disability. And I work with these clients to get the maximum benefits from Medicare. And when you get into Medicare, and when you talk about insurance, the term, we are beneficiaries. We're all in the rooms of beneficiaries for the federal government program with Obamacare. We are beneficiaries for Medicare. And Medicare and SHIP, they provide benefits to the beneficiaries. So that's the categories. And what I'm here to tell you about, I'm here to answer any questions that you may have about Obamacare, the Affordable Care Act, and Medicare. I am appointed with Aetna, Humana, Cigna. There's a 4th one, I can't remember. But I'm appointed with those insurance companies to sell to do the enrollments for their health care plans. And I'm going to rest the mic there and welcome any questions you may have for me. Thank you.
Okay, just as information, we facilitate the question and answers process. And the first question comes from Mary.
I almost forgot my question. Okay, what is the advantage of having, regular Medicare and an add-on drug, plan as opposed to having the advantage that has everything in it?
I'll take that. That's a very good question. Very good question. Medicare is complicated. And if you have members in your families that are eligible for Medicare, there needs to be two people in the family. You know, like I said, the whole family needs to be covered with insurance. There should be two people in the families that are very familiar with Medicare. When you turn 65, or if you have a disability, you become eligible for Medicare. It's a plan, a program that you pay for with 40 consecutive quarters of employment. Nobody told me when I was in school that it's important to work 40 consecutive quarters to be eligible for Medicare. That depends on how much money you get when you retire from Social Security. I'm going to answer your question in a second. When you turn 65, you're eligible for Medicare. That's the red, white, and blue card. Everybody in the room that's 65, you should have that card. That card is for the hospital Part A, for the doctor's office and outpatient care Part B, and they've recently thrown in another category, which is Part C, which has caused a lot of confusion in the community and in the country. So people are asking, what is Part C? Part D is for your drugs. Part C is the private insurance company that I just named that have a contract with the federal government to have processed their Medicare claims. Are we clear on that? Part C is nothing more than Aetna, Humana, United Healthcare was the fourth one, Cigna, and all those companies that sells or enroll in healthcare plans. That's Part C. So it's not, it's a little confusing, but they're just private insurance companies.
I'm sorry.
Can I?
The advantage of having, she asked a question about original Medicare and Medicare Advantage. The Part C is the private insurance companies that have managed Medicare. They process your claims, not the federal government. So with Medicare Advantage, which I have the card in my pocket, and I have my red, white, blue card in my pocket. The Medicare Advantage plan covers Part A, which is for the hospital. Part B is for your outpatient doctors. Part D for your drugs, Tier 1s, 2, 3, 4, and 5. And with the Medicare Advantage, there's some extra benefits. So what are those extra benefits? You get your silver sneakers. Your silver sneakers is a benefit for fitness. Some of the other companies may call it a wellness benefit. You get dental as a benefit. You get vision as a benefit. You get hearing aids as a benefit. You can get doctors, visits, transportation to your doctor's offices as a benefit. You can get monitors, a blood pressure monitor, a sugar monitor for diabetes as a benefit. So I may forget all the benefits that's associated with the Medicare Advantage plans, but that is the advantage of a Medicare Advantage plan. The original Medicare does not provide those extra benefits. I'm going to say this and I'll take my seat. If you're walking around with just your red, white, and blue card in your wallet and purse, and you're 65 years old, you do not have all the benefits that you're entitled to. If you were in a Medicare Advantage plan, you'll have access to those additional benefits. Now I rest my case.
Okay.
The cautions from the other side, from the ship side. We gotta talk about that. Medicare A and B, right, that's your hospitalization, your outpatient, stuff like that. The important part when looking at Advantage plans is to see how much, number one, the HMO, when you look at the Advantage plans over here, the one with the green banner on it, when it says HMO, Health Maintenance Organization, they tend to have smaller networks of doctors and cover less medications, especially non-generic medications. So, lots of people who turn in 65 don't take any medications at all, okay? So, of course, they want a premium, zero premium. If they're not taking medications, they're probably not seeing many doctors, right? So they don't need a lot of doctor care. So they really don't care. They have a primary care if they're lucky. I remember my doctor used to call me every 2 or 3 years. His office calls, Trina, we need to see you. I'm busy right now, Dr. Waxman. We need to see you. It's been 2 to 3 years. All right. So no medications, no chronic illnesses. I still don't have hypertension, blood pressure, any of that kind of stuff. It's thank my mother's genes for that. My dad had all of that. So it depends on how healthy you are. One thing, so you need to compare, and on Medicare.gov, they have a wonderful comparison tool that you can use where you put in your medications and you put in your doctor's names, and you can run a comparison between all, well, you can't compare them all at one time, you can only compare 3 at a time, Advantage plans. Ones you might be interested in, you can pull it up and it'll tell you where your drugs are gonna fall, do they cover them, what tier they're on, that kind of stuff. So Advantage plans look really good for people who are really healthy. Then they start getting into the expensive procedures, and you've got the maximum out of pocket to look at. This coming year, I mean, sometimes it's like 9,000 and something out of pocket, and they go, whoa, okay, that's a lot. So there's the other choice. Again, Medicare A and B, doctors in hospital, they only pay 80% of the charges, so you need something. So the choice is a gap plan or Advantage plans. You could look at gap plans or Advantage plan. The gap plans, from the get-go, you start paying a premium. Even if you don't use them, you start paying a premium. As soon as you sign up with a gap plan and you're 65, you could be paying $80 or more a month, every month. But they pay pretty much everything. You know, you don't have to worry about that. My mom, one thing I inherited from her is her Marfan's heart. She didn't realize she had one until she collapsed at 77. Her medical bill was $768,900 and something dollars. She paid nothing out of all that because she had the Cadillac, the F plan of gap plans at the time. Now it's the G plan. So it took good care of her. And then she got to be 82, 83, and the premium went up to $175, and she was going to cancel it. And I went, no. This could all happen again. They only guarantee your heart repairs for 15 years, okay? So if you keep going, we might need another heart repair. So it was worth it to keep her on that for that length of time. So you do have that option. Advantage plans, but the problem is, if you're in Advantage plans and you start getting really sick and having lots of expensive meds that aren't covered and doctors that aren't covered, it's nigh on to impossible to purchase a gap plan at that time. Because when you first turn 65 and buy a gap plan, they can't even look at your medical history to set your fee. It's all based just on your age. Turn 65, became eligible for Medicare. This is what we charge all the 65-year-olds who are coming onto this plan. Once you get into more complicated medical things, then your gap plan could really, and you want to enroll them on, they might not insure you. And 2, your premium a month could be over $300 a month. So it's a decision that when you're turning 65, are you going to pay as you go and not need it for a while, which is kind of your gap plan. You can pay that premium every month and not need it much. Or you could get an Advantage plan from the get-go and easily have no premium, as you notice on this. You see the premium list there. Premium, no premium, pretty good drug coverage for your lower level tier drugs. You can do that, and just know that as you get older and sicker, then you're gonna be looking at that, monthly max. But the advantage of Advantage plans is you can change them every year. So just think about that. So if you're in an Advantage plan now and you've been on it for 10, 15 years and it's not doing so good, you could look at other Advantage plans. So you can change those every year. So that truly is an advantage. And one of the reasons they did that is because their providers can change every year, their tiers of drugs can change so easily every year. So they want to make it easy on someone whose plan doesn't fit them anymore. They're not a size 8 anymore, they're a size 20. Heck, they might need a new plan. So that is why it is good to be able to look at the plans every year. Okay?
Can I add something to that really quickly?
So I just want to add something to that. Your question was about why would you not just go with what's the difference with going with a prescription drug plan, like original Medicare prescription drug and a Medicare Advantage? I'm going to do the math on her mom. If you just have traditional Medicare and a prescription drug plan, no Medigap plan, no Medicare supplement plan, for 2024, your deductible for going into the hospital, every time you go into the hospital, your deductible is $1,632. That's every time you're hospitalized. Then after then, you're responsible for 20% of the cost, and there's no cap to that.
Right.
So her mother had no other coverage, and this happened in 2024. She would have paid $1,632 as a deductible, and then 20% of over $700,000. You see the danger in not having anything? So whether you choose a Medicare supplement or Medicare Advantage, financially,
You gotta do something.
you gotta do something. It can bankrupt you. So whatever your choice is, and as they both were mentioned, there are different benefits. One size does not fit all. I have a person I talked to, she's 81 years old. She's on one medication, no big deal. At 81, she still doesn't have a lot of illnesses, but her Medicare supplement plan is Plan F, because that's what was available at the time. It's going up to almost $400 a month.
Right.
So now sometimes it just becomes a financial thing. Can I pay $400 a month? Well, she likes a supplement. It gives her the flexibility. She don't have to worry about networks. But if she switched just to a different supplement, she was going to save money and have identical coverage. It's about a $200 difference, $240 deductible for the Plan G. That's it. Yeah. And she's saving over $100 a month. Now, she mentioned HMOs. If you've been employed and had a insurance plan, you know HMOs, you have to stay in network. But the good thing about Medicare is emergencies and urgent care, don't look for a network. If it's an emergency, go to the hospital. They can't look for, require that you look for an in-network emergency or urgent care, 1. 2, there's also PPOs. PPOs allow you the flexibility of going in or out of network. It may cost you more to go out of network, but you can have that option. So I just wanted to let you know about the financial implications of just having original Medicare and A and B, that red, white, and blue card, and Part D, and having nothing else. You have a health crisis, it's going to be very expensive. Okay, I'm sorry, you had a question.
We facilitate the question.
Oh, sorry.
Natalie.
Good morning. I have to do a plug for SHIP because I did know about it and I did go. And for anyone that's listening, this sounds so confusing. But believe me, when you go one-on-one to that SHIP office, they take all the time they need to make sure you understand what it is that you have to make a choice about. They cannot tell you what choice to make, but they will explain it so that you'll know what choice you should make. So I highly recommend anyone going to the SHIP office, even if you're just a little fuzzy on it, they'll give you a good explanation on what it's about. My question, which hopefully is not, anyway, is how do you get paid, those that are our agents?
Excellent question. Excellent question. We are independent, so we do not work for the government. I'm not employed by Medicare. I'm not employed by Social Security. I'm an independent broker that, as Mr. Walls mentioned, we have contracts with the private companies. So for instance, I contract with over 12 organizations in our area that offer 50 plus products in our area. So I get paid commission only. So I only get paid when I write an application. The government sets the amount that we get paid. So he and I, we get paid the exact same amount. So if you were to work with Mr. Walls to help you with your application process, or work with me, it would be the same. Now, one thing that is different about SHIP is that she mentioned they cannot be in the insurance industry. So they can help you unbiasedly with the knowledge. And I'm sure Mr. Walls and I will agree, we provide that type of knowledge too. But once we do the application, yes, we do get paid. And so when I go out and I talk to someone, I do a benefits review unbiasedly, but I know insurance agents have a bad rep. So
Some are bad,
So-
but not most.
not all of us.
Just a few.
Okay.
Few are bad.
So I do a benefit review to help people understand what their options are, but we're able to take it all the way through. So we're able to help you with that application process, help you after the application, because what's gonna happen, you're gonna sign up for a plan that starts January 1st, right? So now it's February, March, April, and you have a question about what's going on with your plan. I didn't get this, I didn't get that, who do you call? And you can call that 1-800 number and speak to your provider, your carrier, and you may talk to Sally and she may be amazing. But when you call back the next month, you're not gonna get Sally again. So that's just a little bit of the difference. Did you want to say something?
And I would like to add, that was a very good question about how do we get paid. Some agents are in the business just for the dollars. That's all they care about. As a matter of fact, the Centers for Medicare, Medicaid have just recently implemented a requirement for all agents to get consent from the people that they're working with.
Mhm.
I have to get your consent to call you. I just can't knock on your front door and say, hey, I'm John Wall, I'm here to talk to you about Medicare. That's a no-no. So I have to get your consent to do Obamacare, and to a large extent, the same thing applies with Medicare. There's a lot of fraud in the insurance industry as it relates to Medicare, because the doctors and the hospitals can bill Medicare for large sums of money for tests and treatment that they do not, or they did not provide to the patients. So it's important for you to review your Medicare statements when you get them. If you get them electronically, or if you get them in the mail, it's important for you to look over those charges and make sure that they're legitimate. You did receive the care that the doctor said he provided. I'll leave it there.
I see something else. And there's a new legislation being proposed for, it would take effect in 2025, that the amount of money that an agent gets paid when signing up someone for a plan will be the same for every plan, because that's where the bad guys have gone bad. They would sign up, agents would sign up someone for the Medicare plan that they make the biggest money on, right? And often, those were the tightest HMOs, meaning they had the less providers, the less drugs. But what they made signing up people on that was more than the plans that pay out better. So that was a big difference. But it is proposed, it hasn't passed yet, at least SHIP hasn't said it's passed yet. But when that happens, there'll be less of an incentive for an agent to put you in a plan that's not best for you. What are the two factors for a plan that's best for you? Do they cover your doctors? And do they cover your meds? And at what level do they pay on your meds in particular? So the meds can get outrageously expensive. So that's the new thing. It will limit how much they can make. All plans will be sold for the same amount of benefit for the agent.
Okay, Crispin.
Good morning. Do you have any suggestions for children that, needing to help their parents with medical decisions? Or can children come to SHIP counseling so we can see what?
We recommend, unless you're the power of attorney.
Unless you're the power of attorney, you need to bring your mom or dad with you, okay? You can't just come on your own. But if you could definitely both come, and we encourage that. And when we talk to people who call wanting help with Medicare, and we realize that they're a little not understanding of what we're trying to explain to them on the phone, even we'll say, will you be driving yourself, or will someone else be coming with you? Great. Is that your son? Great. Both of you can come into the appointment. So it really makes a big difference.
Can
Because it's the dementia and the confusion that can come, and Parkinson's and all that. We see that all the time. But until there's a POA in place, then the person I'm sitting talking to, the person who's signing for Medicare, they have to agree. But if you're the child there, because I did this for my mom, after her heart surgery, you know, she died 3 times on the table that day. So she had a lot of loss of oxygen. So it took a long time for her brain to function right after that, right? So I became her POA, and I went everywhere with her and took her to appointments and all that, and helped her sign up for Medicare and stuff like that. So the children are so important for aging parents. But again, the decision maker is the person who has the right to make that decision. But children can play an ultimate role in that, even if they don't have a POA.
And I have another mic. And on my behalf, you absolutely can come and talk to me. So I wish I would have known that there are, as Mr. Walls mentioned, there are insurance brokers out there that really do want to help.
Yes.
They're not just out, I'm not out for the sale. And I can tell by speaking with him, he's not just out for the sale. So that education is priceless. So absolutely, if there's someone that's like me, that's the one in the family that helps the parents, I want to talk to you. I want to help you understand now, as she mentioned, if you don't have power of attorney though, you can't do the application. But I'd be happy to share the education. As a matter of fact, I sometimes I'll do a webinar. I have one coming up later this month, and I'll give you my information. That's a Medicare 101, for instance. Anybody can come. So, you know, I have a nephew who was born autistic. So at 26, if you've been disabled for 2 years, you go over to Medicare. So he's been Medicare eligible since he was 26. So it's not, I don't have an age of who I talk to. Whoever wants to understand and be able to help their family, because I'm very passionate about helping mine. I talked to a lady one time, and her daughter called me, and she seemed like she had totally was fine here. She filled out a permission for me to contact, as he mentioned. I have to get permission. She filled out the permission to contact, asked me to call her, made an appointment. I went to her house. Her daughter called me and laid into me. And I had to tell her, I completely understand. If someone I didn't know came and talked to my father and I felt that he didn't want that, I would react the same way. So you know what I did? I invited her to come with me as we talked to her mom. Because she needed to feel comfortable with who her mom was dealing with, and I completely respect that.
Did I answer your question? It's a good question. And I said at the top that it is important for health insurance is a family issue. Everyone in your home should have health insurance coverage. Everyone. You can get into Obamacare plan, which is the Affordable Care Act. If they're under 65 years old, if they have a disability, they can apply for Medicare or either Medicaid in the state of North Carolina. Health insurance should be a Thanksgiving Day topic at your table, in addition to your favorite football team. So, did we answer your question? Okay.
Good morning. Appreciate the presentation. Learned a lot. So my question is, I have a 2-part question. One thing about insurance companies is they seemingly can drop you whenever they want. So if you sign up for the gap insurance at 65, however, as you progress in life, things happen. Are they able to just drop you as a car insurance company could a 20-year-old? And also, I'm looking at some of these plans, and a lot of the confusion, at least for me, is I see a plan offered by Humana, which I believe is the drug plan. And these acronyms are killing me too. But the difference in cost is literally $1. So how different can those plans be? And I'm not saying it's designed to be confusing, but you know, just how do you know when you have the right thing?
So if I can address the answer to your question about can they drop you? So the only requirement to have a Medicare Advantage plan is that you have that red, white, and blue card, Medicare Part A and B, and as was mentioned earlier, it doesn't matter what your health is, you just have to have that red, white, and blue card. Now, when it comes to gap insurance or supplement insurance, there's a period that's called a guaranteed issue period. One of those periods is between 64.5 and 65.5. You can have the worst health possible. They cannot reject you. And you can keep that plan as long as you pay your premiums, which probably seems obvious. You don't pay your premiums, yes, they can drop you. Other than that, they cannot drop you. And regarding your prescription drug plan, the cost of the premium may be just a slight change, but as was mentioned earlier, what's important is to find out if your medications are on that plan. So let's say, for instance, the Humana plan is $1 more than an Aetna plan. But your medications aren't on that Humana plan when that's not even an option for you. Then you're gonna definitely have to look at the plan that covers your medications at the tier that's most comfortable for you. Because one could be a tier 2 or 3 on one company and a higher tier on another company. And I know that sounds confusing, but that's where that benefit review helps you to understand what to do.
Okay, point of privilege.
Thank you. But the thing about medication is you don't plan to be on it. So can I alternate plans then if I halfway? And
Excellent
also,
question.
with the premium and the gap insurance, is it capped to a point where it can go, where it could change?
No.
So could it go up $500 when I turn 70 and come out of the hospital?
Now, it usually doesn't go that much, but it usually goes up every year. Some companies, it goes up every year until you're about 80. Some of them, it goes up every year until you're about 89, and then after 89, it stays at that amount. So
is that dependent on your health history?
No, that's depending on the company you go with. So you notice she listed a different companies. So it depends on the company you go with, what their regulation is. And regarding changing your prescription drug plan? Every year. This is the time. Annual enrollment, you can change it every year. Now, you can't know what your health is gonna be like in the middle of the year. So I think maybe a part of your question is, what if it's not an enrollment period and I need a medication that's not on my formulary? And as the gentleman mentioned, yes, you can panic, but don't. There's one thing that you can do. You can request a formulary exception. That means you talk to whatever carrier you're with and say, hey, the doctor says I need this medication and it's not covered by you, will you cover me? And they have to respond to you. They don't have to cover it, but you can do that.
But are you still locked in that contract?
You still locked into that contract until the enrollment
And
period.
you can't have another
Prescription drug plan? No. You only can have one.
Thank you.
Oh, sorry.
Can I just point out on the list on the Humana, you'll notice, one is 4610 and one is 4710. What you want to look at is the fourth column over says coverage during gap. The one that's $1 cheaper does not have coverage during gap, which means when, Part D plans, you get covered, and then when you and the plan spend a certain amount, then you're in a gap and there's not much coverage. Thank goodness Obama fixed some of that and Trump fixed some more of that. But then when you combine, you spend enough, which is a lot, you come out and you get you get out of the gap and you have coverage again. So that's why you have to put in every single one of your meds that you know about, shop for that plan now. Ask for the formulary exception if you get a new drug that's not on the plan, and just be ready to look for new plans during open enrollment.
Okay, now, we have quite a few questions. Okay. Go ahead. And if you want to direct it to all three, or tell us exactly what you want to hear from them. Okay.
Okay. One point of clarification, I'm not sure I understand what gap means, but aside from that, my main question is, if a person turns 65 who is still employed and covered by employee insurance, what are the requirements for non-penalties, and what should a person do?
I can address that because I'm a county employee and I'm covered by our county insurance. So I'm almost 68 and I went on Part A because it's free, because I work my 40 quarters, and the county said, you have insurance with us, you have to enroll in Medicare A, just in case, it's secondary. So you have a time, as long as your insurance with your employer is comparable to what Medicare would be, if you weren't employed and went on Medicare, then there's no penalties for D, signing up for B, for D, and those kinds of things. So you don't have to worry about that. It's just got to be comparable. And if you work for a decent company, their HR department every year gives me a letter saying, and I have to lock in a safety deposit box, they said, because if the house burns down, I'm screwed. But I have a letter that says the insurance I'm covered on with the county is comparable, and so I don't need Medicare every year until I stop working, don't have insurance. So you really don't have to worry about that.
I'd like to add, because I have a situation, and that's a very good question, because I'm working with a client who is continuing to work. She asked about that $170 that's coming from her, would be coming from her Part B premium. Every person on Medicare pays a Part B premium each month. And that premium for 2024 is going to be $170 per month. So if you're working, you're still paying that $170 a month, but it's coming from your paycheck. To answer your question, as long as you are continuing to work and you're on your employer's health insurance, and like Mrs. Palmer said about they have a credible plan, you don't have to worry about that. But I still would caution you to call Social Security and tell them that you're going to continue to work. So you be on record saying that if you stop working, you retire, and you don't enroll into a Part B plan, then you're going to be penalized at 1% per month for the length of time that you were not covered.
But like me, I didn't sign up for B. I don't need to worry about it because I have my credible coverage.
Save that letter.
Right.
And just really quickly,
Annual letter.
if you are not collecting Social Security at 65, you will not automatically be signed up for Part B anyway. Okay? So if you are collecting Social Security, then you're going to be signed up for A and B. So if you're not, understand that doesn't happen automatically. Part B premium that he was mentioning, that $170, $470, it may not be worth it to you if you compare with your employer coverage to sign up for Part B. It may be, I don't know. It just depends on what your company offers. Did he answer your question? So if I can summarize, I think what your question was, what do you do at 65 if you're still working? So here are your two options. You could, if your company has what's called credible coverage, means it's as good or better than Medicare, you are not obligated to sign up for Medicare Part B.
Or A.
Or A. Any of it. Yeah. You're not obligated. Now, if you do decide to sign up for Part A and Part B has a premium, $170, $470. So he was saying.
Yeah. Okay, Jackie.
I'm so happy to have y'all here today. And I first found out about SHIFT as Council of Aging Park and Recreation presentation. And it was excellent. I was just about to turn an age, and it helped me. And I did go with a broker who I met at that conference. And with the broker, she asked enough questions that she could help me because she looked at my profile, and there was an issue on transportation. There was a question, do you need transportation? I said, oh no, I've got a car. She says, well, you never know what's gonna happen. Sure enough, in that same year, I had eye issues. Couldn't drive myself, so I needed the transportation. So, you know, SHIP has been great for me. And this question is somewhat unrelated to Medicare. Trina, can you give just something briefly on Age Friendly with Mecklenburg County?
Age Friendly is an initiative, and I sit on it for Park and Rec. which is to help make Mecklenburg more age-friendly. And that's everything from built, like sidewalks, being able to access billing with sidewalks, and long enough red lights that those of us who have trouble walking fast can get across the light without getting hit by a car, all the way up to policies that impact seniors negatively. So it's a great initiative, and we welcome seniors in particular to be on the committees. Because like I said, it's about everything that could impact you negatively. So age friendly is important. And if you'd like a SHIP appointment, on the front of your thing here, it's got the phone number 704-365-1995. They provide SHIP counselors like me year-round, not just during open enrollment, and we're all over. At Friendship Missionary Baptist Church, we have a SHIP counselor up there. We're in Huntersville and Cornelius, and on far on the east side and all the way down south. So there are SHIP counselors all over the community. They're free. We don't get paid anything, because we don't want any biases. So SHIP is here. But what's nice, like if you see Mr. Wall and you've got family members that aren't eligible for Medicare, then he's got Obamacare. And I don't know anything about Obamacare. I know enough just to be dangerous to say, call John. Please call John. Don't ask me that question. And remember, disability, you just have to be getting Social Security disability insurance payments for 2 years before you'll be eligible for Medicare. Unless it's chronic kidney disease, the day you go on dialysis, you're eligible for Medicare right away, but that's really rare. So there are ways, and that's why SHIP can help. We help people fill out applications for financial help with Medicare, those kinds of things, and we help people. We have direct dial to Social Security. I can call Lisa, my friend, and go, Lisa, I got something I've never heard of before. Help me understand this. So we can also help with that too. So just keep that in mind. And if you're working, if you're a large employer, you probably have credible insurance, some of the little tiny ones. And an HSA is not credible in coverage. It's not credible coverage. If you're just paying into an HSA with your employer, it's not credible coverage. So just keep that in mind as well.
Okay, Suzette, did you want to?
Yes, I turned mine off. Yes, oh, sorry.
Talking about that credible coverage, some of you may be self-employed and know people who are self-employed.
Yes.
And they have Obamacare. I have Obamacare. And I do that also, but when you turn 65 and you're eligible for Medicare, you can't stay on Obamacare. Okay? If you stay on Obamacare, and especially if you're getting a tax credit, they don't want it back. So if you're self-employed or you know someone who does not have employer coverage, and they have this Obamacare, they may think, oh, well, I have government insurance, so I'm good, right? You're not. At 65, you'll need to move that over to Medicare.
Thank you. Okay.
Can I say one more thing? I had to counsel someone that she heard she had to get Medicare, so she got Medicare. She immediately canceled it and went back on Obamacare. I said, no, you can't do that. Because it was cheaper, because she got such a huge financial benefit to be on Obamacare, and her income was just above the financial assistance available to help pay Medicare costs. So just be careful with that. You're right.
Okay, Ellery has a question.
Oh, hey, everybody. Is it on? Thank you. I have had so many questions along the way that now I've forgotten which one is more important. But and this is just for fun. How in the heck do you stop the robocalls? I hope they'll quit when this program closes. You can't answer that. Don't worry about that. We have to work that another way.
It's not me.
I know.
No, when I say
It's the
you,
company's
I
fault.
mean the people who are now working in open enrollment insurances.
Right, yeah.
Now, ma'am, you talked about SHIP. I think I'm in that plan with the state. And I want to get the name of the person who is the SHIP counselor at Friendship. And I'll just let that be it.
Okay.
Because I have too many other
too.
questions.
Okay.
Thank you.
Oh, okay.
I'm a retiree, but I retired as a public school educator in the state of North Carolina, so I have Humana. So I'm looking at all these Humana plans, and what's the difference in my Humana than these Humanas? I mean,
Do you counsel them? We do. Do you
Is
counsel
it-
them? Go ahead if you want.
So we don't work directly with those plans, but of course, I talk to a lot of people who do. The Humana plans that are for, the state retiree program, they're only available to retirees, to state retirees. So that's specific. Sometimes, depending on what it is, and maybe one of you can respond further, it's sometimes a good idea to just compare the public plans to the retiree plans. Because remember, the retiree plan is gonna cover you no matter where you are. My husband's from the Pacific Northwest. There are counties in Washington State that don't have any Medicare Advantage plans at all.
Wow.
So the state health plan will be amazing for someone who lived there if they wanted an Advantage plan, so it just depends.
Yeah.
And we get trained on regular Medicare, and every year SHIP counselors get trained on the North Carolina State Employee Retirement Plan, because it's so difficult. But they've slowly opened it up. They used to only have the equivalent of GAP plans, and now they've got 2 Advantage plans this year. I can't remember. Yeah, to pick from. So the state employees are also having now to compare more plans in-house, and then they also come to a SHIP counselor maybe to compare what is outside of what the state is offering them. Most people still, that I have counseled and pull up the plans and compare them, have stayed in the state plan. They pretty much have, because it's a little bit better benefit.
I'd like to add to that.
Got it.
It's a good question, because if there are any veterans in the room, they have a TRICARE or CHAMP care for veterans, and that's very similar to the North Carolina retirement plans with Humana. It has gotten to the point to where you have to do this annually if you're employed in corporate America. You have, I can think it's 6 weeks to decide, review your benefits. And it can be really challenging for folks who just glance at it and check the box. But later on, you gotta realize that it's an educational process. And I know for a fact, because I have worked in corporate America up until 2022, there are tools on their websites for you to do your budgets, to help establish your healthcare needs. It will help you determine your health plan. So healthcare is a family issue. Everybody in the house needs to be covered. Before I yield, I want to say one other thing is that we have a healthcare crisis in America. And some of you may think it's gun violence, but I like to think that it's a mental health thing. You know, the first thing that the doctor does when you go in an examination room, he takes his stethoscope and he checks what? Your heart.
Your heart and lungs.
Your heart and your lungs. And if you are paying more for items and cosmetics issue for the outside of your body and not paying for the services and the treatments for your inside of your body, your organs that promotes your good health, then you are doing a disservice to your body. If you're paying more for the items on the outside of your body and not paying for the treatment of the things inside of your body, you're doing a great disservice to yourself. If you're not seeing your doctor's primary care physician regularly, if you're not seeing your dentist regularly, your eye doctor, your hematologist, your podiatrist, and I can go on with all of these medical people, you're doing a disservice to yourself. So take your health care seriously, and if you're paying a premium for insurance, it makes sense to use the benefits that you're paying for. I mean, there's no reason your colonoscopies And when you get into Medicare, there are over 20 screenings that are free of charge to Medicare recipients, beneficiaries. It doesn't cost you anything. You go to your doctor's office and he will gladly perform those preventive screenings for you. And lastly, I'm going to say to the men in the room, African American men, we are absolutely at the bottom of the ladder when it comes to our health. The very bottom, we talk more about the NBA, the NFL, than we talk about our blood pressure, diabetes, and hypertension, and some of the mental health issues in our community. And I'll say this and I'll put the mic. If Medicare and Obamacare covers mental health, that's an issue that we do not talk about in our homes. And if you look at the news, when these mass shootings occur at schools and at homes, they would report that the person had mental health issues. So please, if you have Obamacare, or if you have Medicare, consider having mental health counseling. There's nothing shame in that game.
About the vets too, when I first came on in 2004, the vets didn't need Medicare. By 2006 or 7, the VA told them, you need to sign up for a drug plan. Sure enough, they weren't covering so many drugs then. And now, the newer ones that are turning 65, they're actually encouraged to sign up for Part B, pay for Part B as well. Because the veterans have so many young people coming back now injured from our almost wars around the world, that it's just too much for the VA to handle it all. So if you know people who are with the VA and have coverage, don't be surprised if they said, I just got a letter saying I need to sign up for Medicare, and I'm only 45. Well, that's probably because they've been on disability, and the VA just needs help. So please make sure that they know that Medicare could be available for them as well.
Okay, Winston.
Forgive me for my lack of knowledge on all things of this discussion, but two things. I just said, forgive me for my lack of knowledge. I didn't get into my question yet. But my question is, two things that were glanced over without much context is A, you have to work 40 consecutive quarters to qualify.
Just 40 quarters total in your life.
40 quarters. So would that be just being a taxpaying citizen if you're an entrepreneur, or you have to be like employed on payroll?
You had to be paying into Medicare.
You had to pay into Medicare for 40 quarters.
So yes, if you're self-employed and you're paying your self-employment taxes for 10, so 40 quarters is the equivalent of 10 years. So throughout your life, you have to at least work 10 years, 40 quarters, pay into the system, to Medicare, and then you'll be eligible.
And again, it's very triggering to me to hear things that our most vulnerable could be victimized from. I heard about the penalties. How far do you see those penalties go with our seniors? Do they lose houses, or like how?
So in the case of my parents, they went 12 years without having Part B, and that penalty is 1% of the national average for every month over 63 days that you do not have coverage. Now, right now, the national average is about $34. Now, I wasn't in insurance back then, so I don't know how we did it, but we worked with somebody who helped reduce that penalty to about 6 years instead of 12 years, which reduced it a little bit. When it comes to Part B, Part B penalty is 10% per year that you don't have it. So right now, Part B is going to cost in 2024 $174.70. So let's say you didn't get it for 1 year, and then the next year, and then the next year. That's 30% more that you're going to pay for not having it, which is why I think the three of us feel very passionate about making sure people are educated about this. Their children are educated about this, so that they will help their parents or their grandparents. Now, I will say one last thing. If you have this penalty, there is a way that you don't have to pay for it. One, if you're on Medicaid, full Medicaid, you don't have to pay for it. There's also something called the Medicare Savings Program or Extra Help. SHIP can help you sign up for it. I help people sign up for it. I don't have anything to do with it. It's a website on socialsecurity.gov, and if you need help, it takes 15 minutes to fill out the application. But that's something that SHIP helps people with, is this Medicare savings program. Because if people qualify for it, I had no idea it existed. A lot of people work really hard their entire life to buy a house, right? Pay it off, so that when they are over 65, they have somewhere to live.
Right.
If you own a home, you're not getting Medicaid. Your assets are too much.
No, not if you own a home. One home and one car, don't.
Well, from the Medicare savings program, I'm talking about just Medicaid, the straight Medicaid, your assets have to be $2,000 or less. Your home is worth more than $2,000.
No, the house is never counted with Medicaid.
So with the Medicare savings program, it's administered by Medicaid. That Medicare savings program, you can own a home. It could be a $4 million home, and you can drive a Rolls Royce as long as you have one home
And one car.
and one car. So my favorite example of that is Michael J. Fox. Y'all know who he is, right? He's disabled, and he's been disabled for a while, so most likely he has Medicare. And he don't have Medicaid. His income and assets are too much. So it does have to do with what you earn, but you can have a home and a car. So that is a program that's through Social Security, administered by the state, that can help people with those penalties.
Okay, I have a question. This is to John. John, Obamacare. How receptive are your the people that you approach about accepting Obamacare? How approachable? How has that worked for you?
Laura, that's a very good question, and I've been doing Obamacare for 10 years, and 2024 would be 10 years. They are very receptive, especially with the ads that you've seen in Charlotte about a $10 a month premium, as low as $10 a month. But you have to qualify and be eligible to receive a subsidy from the federal government that would pay all of your monthly premiums or a percentage of your monthly premiums depending on your income and how many people in your home and what zip code you live in and whether you use tobacco or not. It's very receptive.
Okay, another part of that question is, what is the least amount that one family can get with Obamacare? And what's the most that you have seen that they have been charged going through Obamacare and you designating an insurance company to work with them?
Okay, a good question. The least amount of premiums, are you referring to premiums?
Yes.
Okay, is $0. I am writing clients, enrolling people. I'm enrolling prospects, which will be my clients, in Affordable Care Act or Obamacare for $0 monthly premiums per month with a $0 deductible. Which means if you go to the hospital, you're not paying a deductible. You went to your doctor's office, I should say you're not going to pay a deductible. To see your doctors or copay. And what's the other part of your question was? Oh, how much will that? Okay.
The most.
Okay, I have one client that's paying roughly $600 a month for insurance from Obamacare, and he loves it. And that's because he has his wife and his daughter with some disabilities, and their insurance bill and their doctor bills are thousands of dollars per month. So he's paying $600 a month, and I don't have to call him. He calls me, Mr. Wall, make sure you sign me up. So again, the Affordable Care Act is, you may hear in the news about how political it is, but it is absolutely a benefit to folks who have never had insurance before. And I've been in the business for 10 years, and I'm delighted. I have taken my Obamacare clients to Medicare, and I've enrolled newly infants in Obamacare, and it's really a relief to know, it's fulfilling for me and rewarding for me to know that everybody in the family is covered by the insurance plans that I represent, everyone in the family.
I think I just got a memo through SHIP that said, what, 70% of the people on Obamacare get some kind of subsidy and couldn't afford it if they didn't get that. So it's a wonderful program for a lot of people.
Trina, thank you for that. Let me just say one other thing very quickly, and I'll pass the mic. You may be wondering, why does the federal government give Americans subsidies to pay their insurance premiums? What makes sense to me that America invests in its citizens. We spend billions of dollars in other countries. For an example, we're spending billions of dollars in Ukraine, and we will be spending billions of dollars with Israel. And over time, we spent billions of dollars with Iraq and Afghanistan and with Vietnam. And if we had taken that money and the federal government had invested into Americans, I don't think we would have anybody on the street that's homeless. That would be money that we could build schools, money that we could provide affordable housing. That would be money that could relieve some of the traffic congestions in our communities. So we need to take that money and invest it in America. And the subsidies, in the form of a subsidy.
So I'll give you a personal example. I have Obamacare myself, and if I did not have any type of subsidy at all, it would cost about $1,100 for my husband and I. So if you make, and I only know this, like my husband does that part, he's not listed it, but he does that part of our business, but I know that if you make over like a certain amount of money, you don't get a subsidy because obviously the government feels like you don't need it. But in harmony with what Mr. Wall said, paying $600 a month versus paying tens of thousands of dollars in health coverage, you know, if you do the math, the $600 is definitely gonna be worth it.
Yeah.
Okay, Jackie, you have a question?
Thank you for that. Thank you.
Similar to what Ellery was talking about, we hear these advertisements all the time about how you can get the free groceries and all of that. Can you speak again on that that you need to have Medicaid and Medicare?
If I can start, first of all, advertisement, that's big money, right? Big money business. They want to get your attention. They got it because they say they're going to give you food. And if you've been to the grocery store, it's expensive. What they don't tell you is how you qualify for it. And as Mr. Walls mentioned earlier, as insurance brokers, we cannot approach you without your permission. But if we dangle this food card in front of you, you decide to call us, now you've given me permission to contact you. So there are usually requirements that you have to fulfill to have the food card. So the gentleman mentioned him earlier, to have a Medicare Advantage plan, you just need the red, white, and blue card. That is absolutely true. But to have a Medicare Advantage plan with the food card, there's an extra requirement for that.
Jackie, that's a good question. As a matter of fact, I spent a lot of time, I've taken a lot of calls about, I want to get that insurance that I can get $300 a month to buy my groceries with and pay my utility bills with. And with Medicare, and it is a Medicare benefit for people who have chronic illnesses and who have Medicare and Medicaid, who have a limited income, low-income folks, who have limited assets. And when your situation on Medicare will be different than mine on Medicare, and where the problem comes in is when the neighbors tell each other, well, I'm getting all this stuff for free, why aren't you getting it?
Right.
That makes them more concerned as to why am I not getting it? I get a call all the time. I want some of that. Well, when it boils down and you do your, when the federal government determines that you are eligible for Medicare and Medicaid and $0 for everything, you don't have any out-of-pocket expenses, then you can get that card. But until you do, you're not going to get the wellness card.
So just one little plug. Sometimes if you have a chronic condition or a special circumstance and you don't have Medicaid, you may be able to get it, but there's always something that has to qualify you.
Oh. And all those, what are they called, add-ons on the Advantage plans, which is everything that normal Medicare doesn't cover, which is glasses, hearing aids, food cards, dental. Those Advantage plans can change those benefits every year. So you buy an Advantage plan for 2024 because it's got everything you want. 2025, that plan may not offer. They can always cut back on that. Sometimes they say, yeah, we pay for eyeglasses. Well, they pay $50. How many people can get a pair of glasses for $50? But they can advertise. They have dental care, eye care, that kind of stuff. So that's why it's real important to look deep into the plan and not believe what's on the advertisement and find out what that plan you're considering does offer for 2024, knowing it's not guaranteed for 2025.
Okay, we'd like to thank you all so much. This has been a lot of information. And we appreciate your coming and sharing and 3 different perspectives about what we're concerned about here at Tuesday Forum, and would love to have you back maybe next year.
Yeah.
Sign up again, but we appreciate your coming.
But John should come open enrollment for Obamacare goes all the way to mid-January. You know, he might need to come back and talk about that. Because that's,
okay.
I don't know anything about it, and people ask me questions, and I go,
Yes, you all have shared a lot this morning, and we still have other questions that we'd like to ask, but we do have to leave this room at 10 o'clock.
Okay.
So once again, we appreciate it, and we love the responses that you all have given, especially the 3 different perspectives on what's happening with insurance. But Ellery has a question that she wants to ask, but we do have to close up. We have a meeting at 10 o'clock.
Okay.
So thank you all again. Let's give them a round of applause.
Thank you for having us. Thank you for having us. Good question.
It was such a pleasure.
Yeah, it's great meeting you guys. I'm glad I got John's card especially.
Awesome. I love it.
I got an insider from Obamacare. I got your number.